Tuberculosis is a leading infectious disease that kills 1.6 million people in the world annually. It is stated that 10.3 million people in the world got infected by TB annually. The major causes of TB morbidity and mortality are lack of access to early diagnosis, treatment and prevention services, and co-infection with other diseases such as HIV/AIDS and diabetes mellitus DM, as well as limited capacity to diagnose and manage multi-drug resistance and MDR TB. In an exclusive interview with the AMN Senior Infectious Disease Advisor at USAID Ethiopia, Dr. Yewelsew Kassie said that despite being preventable, treatable, and curable, this disease kills 21,000 people in Ethiopia every year, more than HIV and malaria combined.
Tuberculosis is a leading infectious killer in Ethiopia and in the rest of the world. So TB kills more people than HIV and malaria combined, by the way. And it has been close to 150 years since TB was known as a public health problem. So if you combine the number of deaths every year, it's like billions of people died due to tuberculosis. It's not luxurious to support tuberculosis program. It's one of the humankind traits. It kills every year 1.6 million people globally and 21,000 people in Ethiopia. And 10.3 million people develop tuberculosis every year, and close to 160,000 people develop tuberculosis every year in Ethiopia.
Dr. Yewelsew also stated that the stigma and discrimination that TB patients are facing is due to lack of awareness of the ways that TB is transmitted.
Continuous education can better be addressed by people who were affected by TB, who survived it, and who understand the stigma, the detail of the problem. So engaging patients who survived the disease, engaging the community, educating the overall the community is the very best approach, and the role of the media is here. The media should communicate the rest of the community that TB is a preventable disease, one, it's a curable disease, two, and it is not transmitted by all means. It can only be transmitted by breathing, and if you mask yourself, you are not transmitting the disease. It can't be transmitted by eating together. It can be transmitted by greeting. It can be treated by drinking with the same utensils or glass. It can be transmitted by breathing, but all others can't transmit the disease. And this can better be communicated by, best be communicated by the media. We do have a great role in terms of reducing stigma and discrimination. More than the health sector, the government, I think the role of the media is very, very important in terms of mitigating stigma and discrimination.
It is indicated that USAID Ethiopia has been supporting the health sector in Ethiopia for the last 60 years through budgeting millions of dollars so as to help Ethiopia achieve the United Nations Global Declaration to end TB by 2030.